It's just part of the scramble. We need to do just as citizens to even follow what's happening in our country, to follow who's dying and who's most at risk of dying and who needs help and who's trying to keep people from dying and doesn't know how to do it, doesn't know how to staff these facilities safely now that the staff is testing positive too, now that the staff is sometimes not showing up. So we're trying to follow it. That emerging disaster in every state in the country, we're trying to follow it. One of the other ways we're trying to follow the real contours of this catastrophe, despite all the happy talk from the White House, is that we've been trying to make contact with individual health providers in different parts of the country to have them just let us know some of what they're facing. Like, for example, this doctor, chief medical officer of his hospital in Newark, New Jersey, interviewed here by WNBC. He says that, you know, as anticipatory and hopeful everybody is about curves starting to flatten and things starting to ease up, at least at his facility in Newark, that's still just hope. He says it's not happening there, at least not yet, and they're pretty sure they know why.
Unfortunately, in the past couple of weeks, it's been very hectic. The emergency room, our hospital has been inundated with a lot of admissions. We're anticipating the surge in this week, and I'm not going to lie to you, it is a source of concern. We did have those 2 weeks of social distancing that we were supposed to adhere to, and unfortunately, we are not seeing the impact that we anticipated, at least in our inner city hospital here at St. Michael's.
The numbers are still going up.
The numbers are still going up. And yes, in the face of PPE shortages, staffing shortages, it's a challenge. But we're rising up to the challenge, and we understand what our role is, which is to serve our community. When it comes to low-income, the low-income population, it's not easy to stay home. A lot of their jobs require them to still show up for work. So social distancing is not easy in that particular situation. So things like that need to be factored in when we address the viral pandemic, especially in the underserved population. The ER is very busy. It's inundated with cases. The ICU, we have a lot of mechanical ventilators that are in use right now, and we just keep increasing capacity to accommodate all those ventilators. But we're rising up to the challenge. We're ready for this, and I think the community as a whole is ready for this. And my only message out to, again, the people in Newark and everywhere else, practice social distancing.
Practice social distancing. Take it from him if no one else. That's a doctor in Newark, New Jersey. Here's a